All right, let's have a look at the endocrine system. So bodily control overall is under the control of the endocrine system and the nervous system. And the coordinator of all of this is the hypothalamus within the brain. So if we just look at the hypothalamus here, within the brain, very, very, very small little gland that has a huge effect on the body. So the endocrine system, we're talking about the pituitary gland, the pancreas, and the thyroid gland, and the adrenal glands. And then we're also talking about ovaries and the testicles and some of the other accessory glands and the parathyroid glands that also affect hormone production and bodily function. And this is just a quick image of where they are in the body. So the parathyroid gland and the thyroid gland sit on either side of the trachea. The pituitary gland is up in the brain. The adrenal gland is on the cranial aspect of the kidneys. The pancreas sits just tucked within the duodenum, the fold of the duodenum. And then, of course, the ovaries and the testicles, depending on the species, are either in the abdomen or outside. The way the endocrine gland works, we call it a negative feedback loop, which means that an endocrine gland will produce hormone. So they're producing hormone A, it's circulating in the bloodstream, and then the bloodstream gives the endocrine gland a reflection of the hormone levels in the blood and helps the endocrine gland determine if they need to produce more or produce less. So it's this continuous feedback loop where the endocrine gland produces the hormone and then it rechecks the blood as it comes back up for circulation and decides if there's enough hormone or if they need to produce more. So the comparison is a furnace. So the furnace kicks on. The thermostat identifies if the temperature is ideal or too hot or too cold. It sends a signal back to the furnace. And then, of course, if the temperature is good, i.e. if the hormones are good in the bloodstream at good levels, then the furnace or the endocrine gland would shut off. So that's the comparison to just compared to negative feedback loops and how the endocrine glands work. In reality, it's much more complicated. It's not typically one singular gland, but rather endocrine gland A affects endocrine gland B, which produces more hormones, and then that gets sent back up to endocrine gland. So the pituitary gland is located in the hypothalamus in the forebrain, and it's responsible for secreting thyroid-stimulating hormone, which then stimulates the thyroid gland to produce hormones. Growth hormone, which is responsible for the growth of bones and regulating energy usage. ACTH, which stimulates the adrenal gland. Prolactin, which is mammary gland development and milk production. Follicle-stimulating hormone is secreted by the pituitary gland and it begins the estrous cycle. Luteinizing hormone initiates ovulation. Antidiuretic hormone is involved in the maintenance of fluids and homeostasis. And oxytocin is responsible for milk letdown and uterine contractions. So overall, the pituitary gland is known as the master control or the master gland because if the pituitary gland is not functioning appropriately, it can result in thyroid disease, poor regulation of blood pressure, inability to ovulate, poor growth and energy usage, etc., etc., etc. So overall, pituitary gland has a huge impact on the body. So we're going to start off the endocrine gland by looking at the thyroid gland. The thyroid glands sit on the left and right side of the first few cartilage rings of the trachea, and they're responsible for secreting thyroid hormones. T3 and T4 help regulate metabolism, and calcitonin is involved in getting the calcium into the areas that the body needs it. So T3 and T4 work together again to regulate the body's metabolism, and calcitonin regulates the body's blood level of calcium, so actually bringing calcium into the cells for usage. And the way it works, it's this negative feedback loop. So we've got, here we go, the hypothalamus, pituitary gland, and thyroid gland. So the hypothalamus produces TRH, which then stimulates the pituitary gland to release TSH, which stimulates the thyroid gland to release T3 and T4. It circulates in the bloodstream, and then the hypothalamus gets an idea of how much of that thyroid is in the bloodstream, and it starts that cycle all over again. So this is a great example of that negative feedback loop. Thyroid gland disease, we have two general categories. We have an underactive thyroid, which is called hypothyroidism, And then we have an overactive thyroid, which is called hyperthyroidism. So for an underactive or hypothyroid, the pet typically is sluggish, they have less energy, they have a poor coat, poor hair coat, and they often experience weight gain because their metabolism is overall slowed down. In an animal that is hyperthyroid, we tend to get hyperactivity, they tend to be underweight, they tend to lose muscle, and they tend to vocalize more. They also tend to have an increased heart rate as well. So the difference is the metabolism is either underactive in hypothyroid or overactive in hyperthyroid. Dogs are most affected by hypothyroidism, whereas hyperthyroidism affects mostly cats. It's very rare circumstances that we would have a hyperthyroid dog or a hypothyroid cat. So looking at hypothyroidism for treatment, we give them a daily thyroid supplementation. So we're essentially just supplementing that thyroid hormone. And in hyperthyroidism, we actually give a medication every day that suppresses the thyroid. So it tells the thyroid to not produce hormones in such high levels. We also could use a radioactive iodine treatment, which is a whole interesting topic. And in your PowerPoint, if you click on advantages and disadvantages, this is an excellent article that was produced by the American Association of Feline Practitioners. And it's really good for pet owners because it gives them an overview of the different products and treatments available to their hyperthyroid cat. So then we move on to the pancreas. So the pancreas it's multifunctional. It has exocrine properties that are involved in digestion, and it has endocrine properties involved in the endocrine system. The secretion of insulin is the main property involved when it comes to endocrine. And what does insulin do for the body? Well, it helps to regulate blood glucose, and it increases the storage of glucose into the cells for metabolism. So if the glucose is just sitting in the extracellular fluid and not actually in the blood cells, then the cells themselves aren't able to use the glucose. So if we don't have enough insulin production, it's called diabetes mellitus, and it could be low or no insulin production by the pancreas. In this case, it may require daily insulin injections in either dogs or cats, or they may be able to be sustained on a high-quality vet diet with low carbohydrates, and that is typically only available for cats. Dogs, most often, if they are diabetic, they tend to have to be on insulin for life. So if we have too much glucose in the blood, the problem in the body is that the glucose, of course, is an energy source, and the cells change it to ATP as a usable energy source for within the cell for production of proteins, metabolism, etc. So if we have too much glucose in the blood, then it's not actually getting into the cells, and it can't be used by the cells. So then the body turns to digestion of its fat and protein sources for energy instead, and this results in an acidic byproduct in the blood. So it's not just that it's too much glucose floating around, but it has all these negative side effects. Clinical signs we see with diabetes is weight loss, polyuria, polydipsia, so increased urine production and then increased drinking, lack of appetite, muscle loss, and then of course when we do some lab work to find out what's going on, we often see a lot of glucose in the urine and the blood. And you guys would see this already on your chem strips. When you do your chem strips for the urine, there's that little area that indicates glucose, and if it's a high glucose, then of course that's a red flag for diabetes. Moving on to the adrenal gland, we have two diseases that we'll talk about that affect the adrenal gland. So the adrenal gland sits on the cranial aspect of the kidney. It's a very small gland with a very, very important responsibility. Overall, the adrenal gland produces many hormones, and these hormones are associated with regulation of physiological stress. So when the body is stressed, those hormones are released to indicate whether the body should go into fight or flight mode, if they should regulate the blood pressure, the heart rate, etc. So Cushing's disease is also called hyperadrenocorticism, and it's where the adrenal gland is overproducing cortisol, so that specific hormone cortisol. Addison's disease, the adrenal gland is underproductive, and it has a decreased production of cortisol from the adrenal cortex. So overall, Addison's is called hypoadrenocorticism, and it's not producing enough cortisol, and cortisol is the key player in allowing the body to regulate stress response. So cortisol is responsible for regulation of blood pressure to a degree, is responsible for maintenance and exchange of electrolytes throughout the body, and as we know, when electrolytes aren't balanced, nothing in the body is functioning appropriately. So hyperadrenocorticism, or Cushing's disease, typical clinical signs are a pendulous abdomen, so a big potty belly, hair loss. In their skin, they often get increased pigmentation. They'll often have polyuria, polydipsia, so they're urinating more and they're drinking more. And then, of course, there are some laboratory changes too that we would see, including fatty serum, lipemic serum, increased blood glucose, and an increase in cholesterol. Couple different causes of Cushing's. It could be a tumor on the adrenal gland, or it could be a pituitary gland tumor. So the one that's most common is a pituitary gland tumor, which of course, because we know the pituitary gland regulates so many different endocrine glands, it of course will affect the adrenal gland. Addison's disease is hypoadrenocorticism, so they are not producing enough of the hormone cortisol. And it ends up in an imbalance of this hormone aldosterone and cortisol. So this results in major electrolyte imbalances in the body. Lots of different causes for this one, so it's not always as easy to diagnose why it's happening. My dog Leia, the Great Pyrenees, had Addison's, and it was really severe. And when we look at the clinical signs for Addison's, they could be anything, truly, because we know that electrolytes affect so many different things in the body. We can get so many different side effects that are associated with Addison's. So it really could be anything. It could be weakness, depression, lack of appetite, vomiting, polyuria, polydipsia, muscle tremors, and the list goes on. My dog, her experience was she had on and off diarrhea for a couple of months, just intermittent diarrhea. And then one day she started to eat a little bit less. And then I remember it was Monday of exam week, and she had this big muscle tremor episode. It looked like a seizure, but she maintained consciousness, and her whole body, the muscles were tremoring. And then by the Friday of that exam week, I remember she couldn't get up. She couldn't walk, she had no energy, she had zero blood pressure, and she was just falling apart. So it's really quite severe. She also ended up with this huge heart murmur in her Addisonian episode. So the clinical signs are really, they can be severe, they can be intermittent, but it can be really challenging. The doctor has to have an idea that it could be Addison's in order to actually diagnose it, just because their side effects or their symptoms are so varied. Okay, so your homework, of course, is to identify from the text 3 things that testosterone is responsible for in the body, and know 2 hormones secreted by the ovaries and their effects on the body. That is it.